It's 14 minutes after 8 o'clock here on 97.1 Wadsworth Community Radio. And, of course, school started this week. And there's a lot of good, fun things, and again, there's a lot of things not to be concerned with, to be aware of. And in the studio with us here, we have Theresa McMillan from the Medina County Board of Health here in the studio with us this morning. Going to talk about just some of the things that are coming up and around, and to be aware of with schools and vaccines, and just all kind of stuff. So welcome.
Thank you. I'm happy to be here.
In other words, for a germaphobe mom like myself, who's desperately
paranoid.
Who's desperately trying to not be so germaphobe. You know, I read an article recently that said the reason that us in the U.S. versus a third world country has more autoimmune issues is because we're so clean. You know, we have so much sanitizer and this and that our bodies aren't even able to fight certain things off anymore because we're too clean. I don't know if there's... it makes sense.
So you're saying we all need to take a trip and swim in the Hudson River for a little bit and come home right now?
I don't know if I would say that, but this is coming from a mom who, my oldest went to preschool last year for the first time, and my youngest was sick from late August through early May. Gosh, the whole school year.
Wow.
I mean, we only had brief breaks. He had peripertussis. He had... croup several times, all that upper respiratory junk. And I'm seeing that we're going to be talking about pertussis again.
Yes.
And I don't want to hear that word, to be truthful with you.
Well, I can understand that. If you've been through it, it's not something that's fun to go through. But as a nurse at the Medina County Health Department, I'm one of the nurses in communicable disease, actually, that investigate cases of reportable illness in the county, and pertussis is a reportable illness. So what
does that mean?
Well, reportable illness is one under the law. Certain illnesses, certain infectious diseases are what they call reportable, which means when a lab or a doctor's office get a positive result, they have to notify us. They have to notify the local health department in the jurisdiction that the person lives in. So if somebody goes to the Cleveland Clinic, they get a positive test result for a certain illness, then they have to report it to the Medina County Health Department. So, and then we investigate it. And pertussis is one of them. There's different classifications, and I'll just touch on that real briefly. There's Class A, which is really severe illnesses, botulism, anthrax, things you never want to hear of. But most of them are what we call Class B, and that's pertussis, Campylobacter, salmonella, hepatitis. Most illnesses fall under Class B. And so what we do is when we get that report, we investigate it. The person will get a call from one of the nurses at the health department, could be me, and we will ask them questions. Where have you been? Where have you traveled? For pertussis, for example, we would ask them, were you exposed to someone who had been coughing? Had you traveled anywhere? We would ask about their vaccination status. So we do an investigation, and that's just to kind of track the illness in the community. Their information is, of course, confidential.
And then I'm assuming, taking that umbrella, opening that up a little bit, then as you try and track that down, I came from here, I was here, all of a sudden then all that data is put together maybe nationally, and you might be able to zero in on a certain area where it may be coming from, and just kind of alert people to try and get a handle on where it may have started or why it's showing up in this area more prevalent all of a sudden.
And I presume that's where recalls come into effect too, with certain foods and such.
Correct. Yeah. If we get, say, for example, I get a report of someone with salmonella, and we've had salmonella reports lately for containers with cut fruit and things of that nature. So those get added to our questions. We're not just asking, what restaurants have you gone to? Where have you traveled? What sort of pets do you have? We might ask, have you had any of this cut fruit from this particular store? Because you're absolutely right. What they do is they take the data and they see if there's any locations. And we're not really talking pertussis now, we're talking, generally. They would track for trends. Did everyone who went to a particular restaurant get ill? Or did anyone who went to a particular location get ill with the same thing? And then they use that and track that down.
Can we talk about... I know what pertussis is because my little guy experienced peripertussis last year. I guess that's a lesser version of it, and that was bad. So I really can't imagine a full-blown version. So let's talk about what pertussis is and how it spreads. And after that, I'd like to get into maybe the forecast for germs going around. Usually it's going to be a bad flu season, we're told, or pertussis really came into our lives last year. I mean, the cases really started to come up. So I'd love to know, what to kind of be on the lookout for this year. I hope you say nothing.
I would love to say nothing. Unfortunately, as long as you have people, you're going to have communicable disease. But addressing your question on pertussis, in particular, the Wadsworth community did note an increase in pertussis cases towards the end of the school year. And we did have scattered cases throughout your community. They were more of them at the beginning of the summer, and they have now trickled off. So we will continue to monitor for pertussis cases for about 42 days. That's what we call 2 incubation periods past the last case. So we will be continuing to monitor that in your community. But in terms of what to look for, because you're right, you're probably thinking kids are getting back together again in school, so what should we look for? Pertussis typically, it was kind of atypical that you got it towards the end of the school year. It's usually something we see more in the winter months. For pertussis, it really is a upper respiratory infection. It is not mild. It can be severe, but what's interesting about pertussis and what causes stress for a lot of parents who think, oh, I should have caught this earlier, is that initially it looks just like a cold.
Exactly.
You have a runny nose, you have sneezing, you have a mild cough, maybe a low-grade fever, but it looks like any number of things, cold, allergies. So people just let it ride. Well,
Until
then
it gets too...
It gets worse.
Then it gets worse. Yeah. Then the coughing develops. The coughing gets much worse. You may have what they call paroxysmal coughing, which is coughing into coughing into coughing, and they can't stop these coughing jags. Sometimes children will throw up afterwards because it is so severe. It is often worse at night. Symptoms vary. Sometimes they'll cough, and then they get that big breath in, and they get that whoop sound. But not everybody does. The whoop is not always a characteristic, so don't think you can't have pertussis if you don't have the whoop and whooping cough, because symptoms will vary for the person. For children, again, it's often worse at night. Young children, infants, adolescents, and adults may not have those typical coughing spells, and older people or partially immunized children may actually have a milder case. So it's actually fairly common. People don't realize that it's around.
But an antibiotic is needed to treat it.
Correct. And typically, the incubation period is 7 to 10 days with a range of 4 to 21. So what we're looking for is when a child starts to cough, they are contagious for 21 days past the onset of that cough. Or, as you mentioned, antibiotics, 5 days after the initiation of antibiotic therapy. In this case, Zithromax is the preferred antibiotic, and you guys are probably familiar with that from a Z-Pack. It's 5 days, easy to take. Children, very young children get liquid, older children will get the pill form, and if they take that, after day 5, they are no longer contagious. So it's either
that cough lingers.
The cough lingers. Yeah, they may have told you it's sometimes called the cough of 100 days.
Yes.
Yeah, you hear that a lot, and it does linger. Sometimes it lingers longer for others. And if you maybe have an underlying condition such as asthma or something like that, it might linger a little longer for you. Or you might recover from it, and then it would come back later the next time you get an upper respiratory infection. Doesn't mean you have it again, but it does mean your lungs are still a little weak from that.
So that's why it's with those kind of incubation periods, a cold maybe 2-3 days, something like that or whatever. And of course, less severity in a cold, but with 21 days and after the antibiotic, you could be around an awful lot of people in 21 days, and I mean that could really take off and spread immensely in that period.
Correct. It can spread. It is spread through someone coughs, you breathe in the droplets, contact with those discharges from the nose and mouth. And that's why it's important. If you have a child and they're developing symptoms, get them in. Talk to your physician, get them tested. Typically, they'll do a swab, which they put a swab down the back of the nose. It's not very pleasant, but it just takes a second. They can get a result within about a day, and then they would prescribe antibiotics for the person, that Z-Pack we talked about, they would say isolate them for 5 days. And that doesn't mean you have to lock them in the room or anything like
Yeah,
that. Just stick to their house.
Common sense,
Yeah,
right.
common sense stuff. Don't go to practice. Don't go to school. Don't hang out with a large group of people. So for 5 days, the family, as long as the family is not developing symptoms, they can. They don't need to be isolated, but they would treat the family with antibiotics as well. They'd put the family on a Z-Pack.
See, it's your fault. No, I'm just kidding. No,
We
that's
weren't put on anything. Is
Maybe
it because it was parapertussis?
Maybe because it was past a certain period of time.
Yeah, it
past
was-
a certain period of time, antibiotics aren't going to be effective.
Right.
That
right.
could have been the case there.
Right, and I know for us. Like you said, it started off. We thought a cold, but as that cough started getting worse and nonstop, is when I finally was like, something else is wrong here. So you're probably. I'm sure that was the reason for that.
Theresa, what typically we see youngsters. Somebody gets a cold from something. It kind of gets passed around. Is there anything parents can do about that, or not? Does it just have to kind of run its course?
Well, it depends on the illness. Certain illnesses are not avoidable. I mean, your colds are going to get passed around. Viruses will get passed around. But with pertussis, vaccination is still your best defense, because you're going to develop that resistance to that bacteria without actually experiencing the illness. Because when you look at vaccinations, I mean, one thing that's great about them is that in order to get immunity from illnesses, you usually have to get the illness. And the nice thing about vaccinations is they give you that protection without having to go through the illness. So vaccination is still your best bet for protection from pertussis. Also, good hand washing, and teach your kids, wash their hands after they cough. Don't cough into their hands, cough into the elbow, because a lot of times people don't think about that. They cough in their hands, and then they open doorknobs, and they're spreading it that way.
Mm-hmm. I'm a big essential oils fan. I've started to come to really like them. I'm not saying that I think they prevent diseases or illnesses, but I really have had some success with, the basic symptom relief, like lavender, for example, to help with when my kids can't breathe, if they have a cold or sinus infection on their nose. That and peppermint oil have been really big. We've been using those a lot, and it's really helped them get relief from those symptoms. Are you able to share anything on that front of essential oils, or is that just, as one thing that you could do to kind of just help maybe alleviate those symptoms, like a cold where there's no cure per se?
I don't have enough information about that to speak on that. You probably have a little more information than I do. But in terms of symptom relief, if that helps your children's symptoms, peppermint oil, I've seen people use that to open airways, lavender to relax them. I certainly think in terms of symptom relief that whatever works for your child, your child best. But in terms of dealing with the bacteria, vaccinations are always going to be the best bet, because they give you that immune protection prior to having to experience the illness.
You have here some facts regarding the benefits of vaccinations. This, we've talked about vaccinations before, that there is a great debate about them. And I've been open and honest. My kids are vaccinated, but I do have concern with them. Part of me thinks it's a moneymaker. Part of me thinks, well, they're not preventative, so why do we do it? Part of me thinks polio, for example, has been eradicated in the U.S., and we're not going to be going to India, so why do we need it? And these were all things we were kind of chatting about off air, and you really did offer some good insight into the reasons why there are a lot of benefits to vaccinations.
There very much are. I do understand your concerns. I do school nursing as well, so I talk to a lot of parents about vaccinations, and I think we can all agree that we're all on the same page in that we want to make certain that the kids are protected. We want to make certain that we're doing the best thing for our children. And I get that when I talk to the parents who have vaccine hesitancy. They're not sure about it. But the benefits of vaccines, for example, your case of polio, you mentioned polio. You're not planning on going to India. India is still a place where wild polio is still endemic. In the U.S., it's been largely wiped out, which is a wonderful thing. But if you keep having people that don't get the the vaccination themselves, what happens is you lose that kind of wall of protection. Because going back a little bit, one of the benefits of vaccination is not just that you're vaccinating your child against a disease that they no longer have to get in order to get immunity. They now have the vaccination. But you're also protecting the people around them that cannot get that vaccine. For example, if you have a child in your son's class, for example, you have a child and they had a transplant, so they're on immune therapy. There's certain vaccinations they can't get. They can't get them. So if your child isn't vaccinated against that disease, they come into contact with them, they could spread that to that person. There are people in the community, for whatever reason, can't get certain vaccinations and rely on that wall of protection that having people immunized around them provides. They call that herd immunity. And I can't state it enough how important that is. It gives that protection to, like, babies, for example. That's another good one. Measles, mumps, and rubella. That's a vaccine you can't get until your baby's a year old. What if you were hanging out with a family who chose not to vaccinate their children against measles and were carrying that? Your child is now at risk. Vaccines protect not only the person, but the community. And the more people that opt out of that, the more holes show up in that wall. So when people maybe visiting from a country where a disease is naturally occurring come over here, they may spread. It may spread because there are people now that are not immunized against that, as there were. And just speaking to polio, I mean, polio, for example, is something people don't think about anymore.
It's terrifying.
It's
for
terrifying.
Starters, yeah.
Yeah, but I think a lot of people don't really fear it anymore because it's been gone for so long. I mean, I have an aunt who I never met. She died prior to my birth because she died from polio. I mean, it was such a serious thing. I don't want to see us get too complacent as a nation thinking that this couldn't happen again. So that's why vaccines have been proven effective, as you see, in eradicating this. If I can't state strongly enough, if more people opt out of that, then that can cause problems for those in the community that aren't vaccinated.
Yeah, Coach, and you mentioned too that, and again, I think we're all more world travelers now. There are more, whether it's international trade, whether it's people going around the country, the Disneyland, Disney Worlds that weren't in locations back in the 50s when polio was eradicated. Looking at things like that, polio might be more difficult to eradicate in the U.S. now than it was back then because we're getting more of that mixture. But again, that mixture is also what, as you mentioned, can all of a sudden bring it back if we take down that wall of protection.
Right, and I'm not trying to be a doomsayer here and say, oh my gosh, it's coming back. I'm just saying the more that we chip away at that, the more problems we may develop later on down the line.
Mm-hmm. I never really thought about it that way. I mean, you just think that it's not here,
that
right?
Beautifully.
Thank you.
Yeah.
I apparently had enough caffeine today.
Teresa, what do youngsters need vaccination-wise, or that when they are going to school, whether it's here in Wadsworth or in Highland or Brunswick or Medina, whatever? What kind of requirements do they need, both when they start school and maybe a little bit later on if they are going into older grades?
Oh, okay. I can tell you that. I also work in the school, so I'm very familiar with the vaccination requirements. The Ohio Department of Health is the one that sets the vaccination requirements. I know sometimes people think it's us at the local health department that do it, but no, it's the Ohio Department of Health, and they're the same across the state. So for children going into kindergarten, what you're going to be looking for is 3 to 4 doses of the DTaP, and that's diphtheria, tetanus, and pertussis. At least one of those doses have to be after the age of 4. You're going to also be looking for 3 or more polio, with 1 after the age of 4. You're going to be looking for 2 MMRs, and that's measles, mumps, and rubella, and they get the first one at least 1 year of age. They can't get it before then. 3 hepatitis B, and they get that first one when they're born. And chickenpox, they're going to need 2. That's also called varicella. Now, they're not required to have any more by the Ohio Department of Health until they get to 7th grade. And in 7th grade, they're going to need what they call the Tdap, which again is the booster for the DTaP. Gives them a nice booster protection as they go on, and meningitis, but meningitis A. Then they don't need another one per the state requirements until 12th grade. and that's the booster for meningitis A.
Then after you're entering into adulthood, is there any vaccinations that we have neglected as adults that should be kept up on? Or by that point in our body development and physical development, have all those immunities, are they pretty much in place?
Well, we do have a certain amount of immunity just from living. We were exposed to certain things. But I would definitely encourage you to talk to your physicians to see where you are, what you need, what you're missing. But in terms of going back to the children real quick, those were just the requirements. Recommendations, the physician will recommend other ones for your children. And that's between you and the physician to discuss. One of them is what's called HPV. That's a human papilloma virus vaccination, and that's given to children around the age of 7th grade. And that helps protect against certain kinds of cancers. It's for boys and girls. Hepatitis A, we have seen an increase in hepatitis A cases in the state of Ohio. Not necessarily in our community, but a definite uptick. So that's something you can, speak to your provider about to see if they might recommend that for you. And the other one is meningococcal B. That's a very similar meningitis vaccination, but it deals with the strain B as opposed to A. And that's something kids might find when they graduate from school and they go off to college, that's required. And then, of course, the Tdap every 10 years.
When you say required, if there are parents, and you have some in every community who opt not for various reasons to vaccinate their children, does that mean they cannot attend a public school in Ohio?
One thing that Ohio allows is what's called an exemption. And you would need to work with your particular school to see what their exemption policies are. You can exempt for medical or religious reasons. And then you would need to talk to them about setting that up. Now, one thing I do need to stress, if you choose to do that, for example, say you choose to exempt your child from the pertussis vaccination, so they don't have any of the pertussis vaccinations. If there is a case in your school can exclude your child until that infectious period has passed for their own safety, for their protection, because they don't have any protection against that pertussis vaccination.
So their protection is just keeping them home until it has run its course.
Until the incubation period has gone by. But the trick with that, and where it gets a little sticky, and I have to tell parents this, is say, for example, you choose to exempt that, and we'll use pertussis as an example, and one child at the school has a case. They choose to exclude your child until that infectious period is passed. Say during that infectious period, another case came up. Well, then it resets, and it resets, and it resets, depending upon how many cases there are, until that infectious period has passed. So that's something to think about for exemption. It's not a punitive thing. Nobody's trying to punish anybody. It's simply a matter of protection. If you chose not to vaccinate,
that's a result, right?
Yes.
Right. And again, it's also to protect the child that wasn't vaccinated too. I mean,
Correct.
it's right.
Can we go back to varicella or chickenpox? That is a live vaccine.
That is a live vaccine.
So I want to talk about live vaccines for a moment. What is the flu vaccine? Is that live also or no?
The flu vaccine is not a live vaccine.
Okay, so this is going back to the age-old question: do vaccinations cause illnesses?
We were talking about that before the show.
I have friends who choose not to do varicella because they would rather, as my one friend puts it, and she would describe herself as kind of a hippie friend, she would rather attend pox parties and let them get the immunity and then build immunity that way versus putting that live vaccine in them. So can you talk a little bit about live vaccinations like a varicella? Does that actually cause chickenpox? That's where I'm going with that question.
No, that's an excellent question. Live vaccines, sometimes people might get like little small taste of symptoms, like someone who gets the chickenpox vaccine may develop a very faint rash, but it's a shadow of what they would have gotten. Most people do not become ill from the vaccine. You cannot get chickenpox from the vaccine. You can, however, maybe have a few slight symptoms that will resolve, but you're not getting the full-blown chicken pox. And as far as chicken pox parties, I mean, when I grew up, everybody got chicken pox. It was just the thing. So they're trying to protect children nowadays, because even though we think of chicken pox as, a mild thing, it can have some severe problems for some people. It can cause a lot of scarring. It can cause some medical problems. So you don't want to treat it lightly.
Once you get chicken pox, you can't get it again?
Technically, that's a good question. You have immunity. Your body has recognized the chicken pox and has formed antibodies against it. But what happens is sometimes people may get a case years down the road, but it would be very mild.
I'm an interesting case with this because in 4th grade, I brought chicken pox home to my mom, and she got it. I never had the signs and symptoms of it, but blood work done showed that I did have it.
Yeah, your body fought it off and created antibodies. You were a carrier.
Yes, I'm a carrier. Sorry, everyone. Go body.
Yeah.
Well, we're turning your
we
mic
all
down.
have immunity here, so we're good.
Yeah.
We're good.
Well, could we talk about what that means to be a carrier? And does that only mean for me, for example, that was just that one illness, but does that mean that I'm a carrier of everything?
No, it just means that you were exposed and you didn't develop the symptoms. And the way, you can't know if someone's a carrier of certain things. But I would say the best protection is just make certain that people are vaccinated, so that if you are carrying something but maybe not symptomatic at that point, they're still protected against it.
When you talked about chicken pox, is the same true for measles? I've heard over the years that when you get measles when you are an adult, it's not good. Is that true?
Well, getting measles at any age is not good. You don't want measles.
Measles
I
scares
have
me,
heard
yeah.
of people doing measles parties, and I think that's insane. I'm sorry.
I don't even want to do a
think that
cold
is unwise. let me back that up. I think that is unwise. Yes, measles are nothing to sneeze at. So just if you can vaccinate against that, do so, because it is a very serious illness. It's not to be taken lightly. Chicken pox, in particular, when people get it older, may become something called shingles, which is very painful and is also something you want to avoid. They do have a new shingles vaccine out there, so I would definitely recommend talk to your physicians if you feel it's appropriate. Definitely, they recommend people over the age of 50 to get the shingles vaccine, and there is a new one out there that is very effective.
Theresa, wanted to recap again for this upcoming school year, the school year that has just started, some things in the area to look out for in terms of illnesses, anything that's high on the radar from the state or in the county?
Well, we're going into flu season, so that's always a big thing right now. Flu, I know we talked before the show about the vaccination for flu and how they try to get the best possible match, and sometimes there's a shift, and what they anticipated it was going to be, it isn't. It is a little bit of a guessing game with the flu, because what they do is they take the information from the previous year and make their best guess as to what's going to be the worst case, what's going to be the prominent strains of flu. And so they have what they call either trivalent vaccines or quadrivalent, which means they either have 3 or 4 of the most common strains of flu. And they're killed vaccines, so they're not going to get you sick. I know that's another debate. I hear a lot of questions about the flu vaccine. It's a killed virus. It can't make you sick with the flu. But they try to anticipate what's going to be the best match for the coming year. And sometimes things change. They're not always the best match. But one thing to think about is if you get your flu shot every year, that's more and more and more strains every year that your body now recognizes and has created antibodies against. So if you get your flu shot every year, that's more and more protection year after year that you have. Now, it doesn't mean that you won't get that one strain that wasn't covered, but it does mean that your base of protection is much stronger than someone who just gets a flu shot every now and then, or if they hear it's really bad, they run out and get a flu shot.
Okay, so in other words, then you do build up. In other words, if you've been getting a flu shot for 10 years, that very first year, whatever the strain was in there, you have the immunity from that that first strain from 10 years ago.
That's the
In
point.
general,
in
right,
general,
right.
yeah, that's the point.
Thanks,
Now,
I get
immunity
that.
does wane over time, which is why you have boosters. But yes, I mean, when you get a flu vaccine, you're tricking your body into creating antibodies against an illness it doesn't have. So the more of the flu vaccine you get, the more antibodies your body has created.
And again, you know,
Can we all just high five our bodies? Like, aren't they amazing?
They are amazing.
They're
That they can
amazing.
remember this. I mean,
They're
there's
amazing.
think about all the things that you come up against just walking around in the world that you don't even know that your body takes care of, because
Amazing.
it's an amazing, marvelous thing. If I want to just take a moment here, if I can interrupt you guys, and I want to give kudos to the community of Wadsworth. You guys are amazing. You guys, as a community, with your residents and your providers, they really care about vaccination and the health of the community. We have a lot of clinics that we come out to here. We go to the high schools, we go to the middle schools, we go to flu clinics all over the community during flu season. We even have a regular vaccination clinic at the hospital one day a month too. So, I mean, you guys have opened up your arms to vaccinations and being very proactive in that. And I get a sense that this community really cares about the health of its residents and its children. And I just want to say, well done. Well done, Wadsworth.
We need our round of applause. You're behind on this. You're behind. Well,
awesome.
Theresa, I think the last thing that we have time to touch on today is Medina County Health Department is celebrating its 100th year this year.
Yes, yes.
New logo last year. Well, maybe that was
New
earlier
logo. It
this
was
year.
this year,
This
yeah,
year,
new
yeah,
logo.
with the yeah, that's right, with the birthday as well. Wow.
Yeah, 100 years of serving the community. It's I've worked in I've been a nurse over 20 years. I've worked in a lot of areas, and public health is just fascinating. It's wonderful. It's a privilege. So yes, 100 years for the Medina County Health Department. So we're very excited about that.
Now, see, Tina, of course, you know, a lot of people worked on the vaccination end or whatever, being involved with Main Street Wadsworth and whatever. I get involved with the department coming down for a lot of our venues. I mean, we'll see everybody down here for the Taste of Wadsworth next week.
Oh, we love coming.
Right, and again, those are just those things that you work hand in hand with everybody. You know, and again to ensure the safety of anyone that's coming down here to eat, or and again, even the food trucks and things that are down here. You know, there are certain ones that, I mean, they have their certificates. They're on file, and again, all that is vetted, and again, all that is through all the you know, whether it's Medina County or whatever it happens to be. All those are vetted, and again,
Correct.
so I mean, I can you know, I'm going to throw a little bit of thanks back to you, because again, that process gets. I mean, it's a process, but it's necessary, and it's very easy. You know, it's very simple, and again, it's great working with the health department on all of our venues down here from a Main Street standpoint. So
Thank you.
And nobody thinks of when they come to the Taste of Wadsworth or any event that you have to check out. They never give you a second thought, because they think, oh, we just go in and, you know, we have our hot dog or a donut or
Right.
whatever.
Right.
But it's all of you behind the scenes that are taking care of all this.
Right.
And
Go
I'm
ahead.
sorry, I was going to
No.
say there's a lot that you can offer this Wadsworth community.
And you know what? Yeah, and one thing too that I think a lot of people, and I always like to remind everybody too about this, is that you have a service there. Like, let's say that we're going, someone's traveling, whether it's out of maybe just to California, you don't have to be out of the country,
Right.
to a certain area. You can come to the health department and they'll say, they'll do like a disease kind of triptych for you.
Right, exactly. If you are traveling overseas or any place, if you want to know what sort of vaccinations you need for the travel, come to the health department. We can check that out. We can see the CDC recommendations for various areas. We can check your vaccine record, see what you have, see what you may need. Sometimes you don't think about, oh, I only need it because I'm going to this place. But sometimes if you have layovers at certain airports, certain countries will require you to have a vaccination just being in their airport. So these are things that we can help you figure out if you need at the Medina County Health Department.
Very cool.
Yeah, it is very good. I didn't know before I started working there just how many services they have. Like you said, checking the food. They go to all the restaurants in the county. At the fair, all those carts, they went to all of those. They make certain that they're using best practices. They have the environmental people check your water, make certain the plumbing's good. Environmental does, mosquito checks for the area. We have public health. We have WIC. We have a health center there. We actually have a health center with a physician. So if you don't have a primary care physician, you can come there. Or if you need vaccinations, you can come there as well.
I think just newly remodeled, ribbon cutting not too long ago in that health center. Yeah, very
just
good.
Remodeled. Yeah, it's very nice. And dental too. I forgot to mention dental. We do dental too.
Wow.
Teresa, thanks.
My pleasure. It was an honor to be here.
Great having you here. Provided a lot of good information and all that. We appreciate your time.
Thank you very much.
Appreciate it. It's 48 minutes after 8 o'clock here on 97.1 Wadsworth Community Radio.